So at the September Council meeting, Council approved a new strategic plan for 3 years from 2026 through to the end of 2028. This carries on from our previous plan, which was really developed during COVID. So rather than having 5-year plans, we're having 3-year plans. One aspect of the new plan is a slight tweaking of the purpose of ANZCA. So we now make it that the purpose of ANZCA is to serve our patients, public and workforce in leading in anaesthesia, pain medicine and perioperative medicine to improve health and well-being and reduce the burden of pain, which is, I think, a good evolution of our purpose. I'm hoping that fellows will find the overall ideas in the strategic plan, but particularly the practical points of where we want to go in the future. None of it is a massive surprise. It's evolution, not revolution. And there is a link to the strategic plan in this President's message email. So following on from a recent meeting with federal government around rural workforce, I have an important message, I guess, particularly for selection panels. So when I talk about rural, I do in fact mean regional, rural and remote. But there's now an expectation by the college, following on from guidance from a number of authorities, including the Rural Health Commissioner, that elements of what we call rurality or rural experience are included in training selection. And those elements are that a reasonable part of someone's childhood has been spent in a rural area, that a reasonable amount of their medical school years in a rural area, and again, their junior doctor years in a rural area, and that all three are more than additive. Now, the best document on this, and ANZCA will provide our own, is called Selecting for Rural, available through the College of Surgeons. We'll also make that available, but explains rationale, explains the rurality criteria, but also how they can be assessed. So to reiterate, we now expect, not mandate, but we expect that trainee selection panels across Australia, and I think also including New Zealand, need to include rurality in their assessment. We're not saying how much, but we expect it to be done. In addition to assessing rurality, it is worth reminding selection panels that there are elements of selection that may really bias towards those who have the opportunities of working in the city. This includes things such as research experience. And whilst it's not formal trainee selection, many programs do actually include feeding in junior doctors through HMO critical care programs. And in reality, the rurality selection criteria really should be added to those as well. As many will be aware, there was a statement made from the White House in the United States about paracetamol, as they call it, acetaminophen, or trade name Tylenol, which was full of both misinformation and misogyny. The Dean of the Faculty of Pain Medicine, Dilip Kapoor, was very quick to write for ANZCA a statement around paracetamol, reiterating the worldwide acceptance of the evidence that paracetamol in pregnancy is the best simple analgesic option. We need to remember also that other options such as non-steroidal are less desirable, but even more importantly, that the cause or the reason why one may need to or want to take paracetamol may actually be more harmful for the child than any possible side effect of paracetamol itself. I'm mindful of Brandolini's law, which states that the amount of energy required to refute bullshit is 10 times that required to create it. The drivel that has come from south of the Canadian border that is so anti-science is very disturbing. So we're actually recording just before the Australian Society of Anaesthetists. Our colleagues, the ASA, have their national scientific meeting, and I'm confident it will go very well. However, I won't be there because my older son's getting married, yay. But I've told Mark Sinclair, the president of ASA, and Vita Vilnius, the incoming president, about this, and they were very gracious that I wasn't going to attend and accept my apology. But I also really want to reiterate and thank Mark Sinclair, as who's about to become immediate past president of the ASA, for his great collaboration with the college. We've worked together, often behind the scenes, on a number of areas, and recognise our major collaborations are really our responsibilities are training for the college and industrial matters, including billing for the ASA. I really look forward to working with Vida as she comes in as president, and congratulate her on her achieving that role.